Did you know that following your doctor's blood pressure advice could actually be putting your life in danger? I know that sounds crazy, but stay with me because what I'm about to share might completely change how you think about blood pressure management, especially if you're over 65 years old. Before we dive in, hit that subscribe button right now and ring the bell. Trust me, the information we share here could add years to your life. Do it now. Done? Perfect. Let's continue. Here's something shocking. For the past 50 years, doctors have been telling us the same thing. Your blood pressure should be 120 over 80. Period. Lower is always better. But recently, groundbreaking research is turning this belief completely upside down. Right now, drop a comment with your age and latest blood pressure reading. Just type it like 72 years, 135 over 82. I want to understand who's watching because this matters more than you think. Let me tell you about Barbara. She was 79 years old and living a wonderful life. Barbara loved her garden, volunteered at the library, and looked after her great-grandchildren every weekend. She was energetic and independent until something changed. Barbara's blood pressure was 148 over 88. Her doctor immediately prescribed medication with one goal: get Barbara to 120 over 80. After 2 months, Barbara was at 124 over 78. Her doctor increased the dose. 2 months later, she was at 120 over 76. Almost perfect. He added a second medication to fine-tune it. Barbara trusted her doctor completely. She took both medications religiously. After 2 months, her pressure was 122 over 76. Her doctor was thrilled. Perfect, he said. This is exactly where we want you. At first, Barbara felt maybe a bit more tired, but she was 79. Being tired was just aging, right? Then Barbara started noticing something strange. Every time she stood up, she'd feel dizzy for a few seconds. The room would spin. She'd grab something and wait until it passed. She mentioned this to her doctor. That's probably just age, he said. Your blood vessels aren't as elastic as they used to be. It takes a moment for pressure to adjust when you stand. It's normal. Just stand up slowly. Barbara stood up very slowly, but the dizziness kept happening, every time. She started feeling anxious about standing. She began moving around cautiously like she was afraid. Her daughter noticed. Mom, you're moving like you're scared. What's wrong? Barbara explained the dizziness. Her daughter said she should call the doctor again. The nurse called back with the doctor's message. As long as your blood pressure is good, the dizziness is probably just age. Make sure you're drinking enough water. The dizziness continued. Then one morning, 3 months after getting to 122 over 76, Barbara woke up needing the bathroom. She sat up, swung her legs over, and stood up. The room spun violently. Her knees buckled. She reached for the nightstand but missed. She fell hard, hitting her hip on the corner on the way down. The pain was excruciating. She couldn't get up. Her husband heard the crash and called 911. Paramedics checked her blood pressure. Lying down, 116 over 72. Sitting up, 92 over 60. Standing, 80 over 52. Severe orthostatic hypotension. Her pressure was dropping dangerously when she changed positions. The medications had gotten her pressure so low that her body couldn't maintain adequate pressure when upright. Her brain wasn't getting enough blood flow. That's what caused the fall. X-rays showed a completely fractured hip. She needed surgery, a hip replacement. But Barbara was 79. Surgery at that age is risky. Infection, blood clots, pneumonia, anesthesia complications. But without surgery, she'd never walk again. The surgery went well, but recovery was brutal. Hospital for a week, rehab for 3 weeks, physical therapy twice daily, exhausting and painful. Before the fall, Barbara had been independent. Now she needed help with everything: getting dressed, bathing, walking. She felt like she'd aged 30 years overnight. Barbara finally went home after 4 weeks, but she wasn't the same. She was terrified, afraid to walk without her walker, afraid to move fast, afraid to be alone. Her daughter had to move in. Barbara's world had shrunk. Before the fall, she'd been active. grocery shopping, church, visiting friends. Now she barely left her house. Too afraid, too weak. Comment dizzy if you get dizzy when you stand up regularly. This is a critical warning sign that your blood pressure might be too low for your age. But here's the tragic part. 6 months after the fall, Barbara developed pneumonia. She'd been sitting and lying down so much, afraid to move, that fluid accumulated in her lungs. Pneumonia in someone almost 80 with reduced mobility is extremely dangerous. Barbara was hospitalized, given antibiotics and oxygen, but her lungs couldn't clear the infection. Her body was too weak. Barbara died 3 days after admission. Her daughter was devastated and angry. Mom was fine before they lowered her blood pressure so much. She was active, independent, happy. Then they got her to 120/80 and she started falling. That fall started a cascade that ended with her death, all because her blood pressure was too low. But her doctor said 120/80 was perfect. How can perfect kill someone? That's the question. How can a perfect blood pressure number kill someone? The answer is that 120/80 isn't perfect for everyone. It's especially not perfect for seniors. For people over 65, sometimes over 70, aiming for 120/80 can be dangerous. It can cause exactly what happened to Barbara. Falls, fractures, decline, death. Barbara's story should terrify you, but it should also make you angry because Barbara's death was preventable. If her doctor had known that 120/80 was too low for a 79-year-old woman, if he'd targeted a higher number, Barbara would still be alive today. She'd still be independent, still active. But he didn't know. He was following outdated guidelines that don't account for age, don't account for the unique physiology of older adults. So what is the right blood pressure for seniors? I'm going to tell you, but first, you need to understand why seniors are different. Why the rules for 40-year-olds don't apply to 70-year-olds. Why 120/80 might be perfect for middle-aged people, but dangerous for older adults. First reason, blood vessel stiffness. As you age, your arteries become less elastic. They stiffen. This is called arteriosclerosis. Stiff arteries can't expand and contract as easily. When your heart pumps, stiff arteries don't absorb the pressure wave efficiently. This means you need slightly higher pressure to maintain adequate blood flow to organs, especially your brain. In young people with flexible arteries, 120/80 ensures good blood flow even when standing. But in older people with stiff arteries, 120/80 might not be enough. When they stand, their stiff vessels can't adjust quickly. Blood pressure drops. Blood flow to the brain decreases. They get dizzy. They fall. Second reason, baroreceptor sensitivity. Baroreceptors are sensors in blood vessels that detect pressure changes and signal your brain to adjust heart rate and vessel tone. In young people, these respond instantly. When you stand, they detect the pressure drop and immediately signal your heart to beat faster and vessels to constrict. This maintains blood pressure and prevents dizziness. But baroreceptors become less sensitive with age. They respond slower. So when an older adult stands, their baroreceptors don't react quickly. If their pressure is already low at 120/80 and their baroreceptors are slow, they'll experience a significant pressure drop before their body compensates. This is orthostatic hypotension, and it causes falls. Third reason, medication sensitivity. Older adults metabolize medications differently. Kidney function declines with age. Liver function declines. This means medications stay in the body longer, have stronger effects. A dose appropriate for a 50-year-old might be too strong for an 80-year-old. They might experience excessive lowering. Too low, dangerously low. Fourth reason, older adults have different risks. In younger people, the main risk from high blood pressure is damage over decades. Heart disease, kidney disease, stroke. But in older adults, the immediate risk from low blood pressure can outweigh the long-term risk from moderately elevated pressure. A fall from low blood pressure can kill an 80-year-old within months, but pressure of 140/85 might not cause problems for years, if ever. Hit that like button and share this video. This information needs to reach more people, so the calculation changes. For a 50-year-old, aiming for 120/80 makes sense. They have decades ahead. Preventing long-term damage is important, but for an 80-year-old, preventing falls might be more important than achieving a textbook number. Now you're desperate to know the actual number. What should your blood pressure be if you're over 65, over 70, over 80? I'm going to tell you, but first we need to look at what the research shows because it's surprising and contradicts what most doctors have been taught. Traditional guidelines saying everyone should aim for 120 over 80 came from studies done primarily in middle-aged adults. People in their 40s, 50s, early 60s. These studies showed lower pressure reduces heart attack and stroke risk. That's true for that age group, but very few studies looked specifically at people over 75 over 80. The SPRINT trial published in 2015 looked at intensive blood pressure lowering. They compared a target of less than 120 systolic to less than 140 systolic. The intensive lowering group had fewer cardiovascular events. This led to widespread recommendations to push pressure as low as possible. But most people miss something critical. The SPRINT trial excluded many typical older adults. They excluded people with diabetes, prior strokes, frailty. So results don't necessarily apply to the average 80-year-old. Then came groundbreaking research published recently. This study followed over 15,000 adults over 75 years old. Real-world older adults, including those with diabetes, prior strokes, frailty, they compared outcomes based on average blood pressure. Here's what they found. Among adults over 75, those with systolic blood pressure between 130 and 145 had the lowest mortality. Lower than those with pressure below 120, and lower than those with pressure above 155. The group with pressure below 120 had increased risk of falls, fainting, acute kidney injury, and death. The group with pressure above 155 had increased risk of stroke and heart attack. But the sweet spot, the pressure associated with longest survival and best quality of life, was 130 to 145 systolic. Researchers were surprised. This contradicted prevailing wisdom. But when they analyzed deeper, it made sense. For older adults, especially over 75, having pressure slightly higher than traditional targets provided better perfusion to vital organs, especially the brain. It prevented orthostatic hypotension. It reduced fall risk. And these benefits outweighed any theoretical increase in cardiovascular risk. Comment 130 to 145 if this number range is sticking with you. But the right target isn't exactly the same for everyone. It depends on your exact age, overall health, whether you have diabetes or kidney disease, and how frail you are. For adults between 65 and 74 who are generally healthy and active, a reasonable target is systolic 130 to 140, diastolic 70 to 85. This protects your heart and brain while reducing fall risk. For adults between 75 and 84, the target shifts higher. Systolic 135 to 145 makes sense for most people. Your arteries are stiffer, reflexes slower, and you need that extra pressure for good blood flow, especially to your brain. For adults over 85 or anyone who's frail regardless of age, systolic 140 to 150 is often appropriate. Preventing falls and maintaining independence is more important than achieving a perfect number. If you have diabetes, prior stroke, or heart disease, you might need slightly lower targets, perhaps systolic 130 to 135. But even then, not as low as 120. If you have chronic kidney disease, it's tricky. You need enough pressure to maintain kidney function, but not so much you damage kidneys further. Usually, systolic 130 to 140 works best with careful monitoring. Comment which category you fall into. Type like 72 and healthy, or 79 with diabetes, or 84 and frail. Now let me teach you something incredibly important that could save your life. It's called checking for orthostatic hypotension. This is more important than knowing your regular pressure because it tells you whether your pressure is dropping dangerously when you change positions. Here's how. You need a home blood pressure monitor. Lie down flat for 5 full minutes. Rest completely. Check your blood pressure while still lying down. Write it down. Next, stand up and immediately check your blood pressure again while standing. You might need help because you need to check it right away. Compare the two numbers. If your systolic drops by more than 20 points when you stand, you have orthostatic hypotension. If your diastolic drops by more than 10 points, that's also orthostatic hypotension. For example, if your pressure lying down is 132 over 80, and when you stand it becomes 108 over 68, that's a 24-point systolic drop. That's significant. That's dangerous. Even though 132 over 80 seems reasonable, if it's dropping that much, your medications need adjustment. Barbara had severe orthostatic hypotension. Lying down, 116 over 72. Standing, 80 over 52. A 36-point drop. No wonder she fell. If someone had checked this, they could have caught the problem before the fall. Share this video right now with anyone you know who takes blood pressure medication. This could prevent someone from falling and breaking a hip. Let me address common questions. First, my doctor says I must get to 190 over 80. How do I talk to them about this? Print out information about recent research on blood pressure targets for older adults. Show your doctor the science has evolved. Most doctors, when presented with evidence, will consider adjusting your target. If your doctor refuses despite your symptoms and concerns, it might be time for a second opinion. Second, I'm on multiple medications, and my pressure is still 148 over 86. Should I add another medication? Maybe not. If you're over 70 and feeling fine at 148 over 86 with no orthostatic hypotension, that might be perfectly acceptable. Adding another medication might cause more problems. Third, what if my blood pressure varies throughout the day? Some variation is normal. Pressure fluctuates based on activity, stress, time of day. What matters is the average over time. Keep a log for 2 weeks. Check morning and evening. That average is much more meaningful than individual readings. Fourth, can I just stop my medications if I think they're making me feel bad? No, please don't. Never change medications without talking to your doctor first, but absolutely make an appointment to discuss concerns. Explain your symptoms. Bring your blood pressure log. Have an informed conversation. Let me give you an action plan. This is exactly what you should do. First, get a home blood pressure monitor if you don't have one. Check your pressure twice daily for 2 weeks, morning and evening. Keep a detailed log. Second, do the orthostatic hypotension test I described. Lying 5 minutes, check pressure, stand, and check immediately. Write down both numbers. A significant drop is critical information. Third, write down any symptoms. Dizziness, fatigue, mental fog, weakness, be specific. When does it happen? How often? How severe? Fourth, make an appointment specifically to discuss blood pressure management. Don't squeeze this into a regular checkup. This deserves dedicated time. Fifth, bring everything. Your blood pressure log, orthostatic test results, symptom list, and all medications including supplements. Sixth, have an honest conversation about what target makes sense for you based on your age, health status, and how you're feeling. Don't be afraid to question whether 120 over 80 is right for you. Seventh, if you adjust medications, do it gradually. Change one thing at a time, monitor carefully, watch for improvements and new symptoms. Be patient. Eighth, recheck everything every 6 months. Your needs might change. The right target at 70 might not be right at 75. Stay proactive. Comment action plan if you're committed to following these steps. Let me talk about diastolic pressure, the bottom number. Most conversations focus on systolic, the top number, but diastolic matters too. Diastolic is the pressure when your heart relaxes between beats. This is when your heart muscle itself gets blood flow. For older adults, diastolic below 60 can be problematic. Ideally, you want diastolic between 70 and 85. Not too high, not too low. If your systolic is in a good range but diastolic is below 65, that's worth discussing with your doctor. Now let me give you the complete summary. This is what you need to remember. For most adults over 75, systolic blood pressure of 130 to 145 is associated with best outcomes. Lower than 120 increases risk of falls, orthostatic hypotension, acute kidney injury, and possibly dementia. Higher than 155 increases risk of stroke and heart attack. The sweet spot is the middle range. For adults 65 to 74, targets can be slightly lower. Systolic 130 to 140 is very reasonable. Some healthy 65-year-olds might do well around 125 to 135. But if symptoms develop or orthostatic hypotension appears, a higher target is better. For frail older adults, regardless of age, preventing falls is the priority. Targets should lean higher. Systolic 140 to 150 is often most appropriate. Function and independence matter more than hitting a specific number. For older adults with diabetes, prior stroke, or heart disease, targets need individualization. Generally systolic 130 to 140. Occasionally lower if tolerated without symptoms. Close monitoring is essential. Diastolic should generally be kept above 65, ideally 70 to 85. Very low diastolic reduces blood flow to heart and brain. Orthostatic hypotension is often more dangerous than moderately elevated blood pressure. Check for it regularly. If present, medications likely need adjustment. Comment I understand if you followed all this and understand that blood pressure targets for older adults should be higher than traditional guidelines suggest. Here's my final message. If you're over 65 and your blood pressure is being managed to hit 120 over 80, but you're experiencing symptoms like dizziness, fatigue, falls, or mental fog, speak up. Question whether this target is right for you. If you're feeling great at 136 over 80 with no symptoms and no orthostatic hypotension, maybe that's perfect for you. Don't let anyone make you feel like you're failing because you're not hitting some arbitrary number. Advocate for yourself. Bring research to your doctor. Ask questions. Insist on being treated as an individual, not a number on a chart. Your health, your quality of life, your independence matter more than perfect numbers on paper. Comment, I will advocate if you're committed to taking control of your blood pressure management. Hit subscribe and turn on notifications so you don't miss future videos on healthy aging with accurate research-based information. Share this video widely. Post it everywhere. Send it to everyone. This information could prevent someone from falling. It could save someone's independence. It could literally save a life. Thank you for watching all the way to the end. The fact that you're still here tells me you're serious about your health. That's exactly who we want in our healthy aging community. Drop a comment with your biggest takeaway. What surprised you most? What are you going to do differently? Don't forget to like, subscribe, and share. I'll see you in the next video where we'll tackle another critical topic about aging well. Until then, take care of yourself, question everything, and remember you deserve to feel good, not just to have good numbers on paper.